I'm here to help you understand your joint problems if you are having TMJ joint problems. If you have joints that click, pop, feeling pain, then this video is for you. This pointer to show you the joint anatomy of this TMJ joint, which is the hole you see here is the ear canal. The little blue thing that you see here is the disc. And if you're having any kind of noise, then this disc is popping in and off of this rounded condyle. And what is happening here is that this joint is compressed into the what they call mandibular fossa. That's what this mandibular fossa is. This is the skull, and this is the jaw, and this is the condyle jaw, and this is the disc. Have to ask yourself, why is the joint back too far, and why is this little disc off of the condyle? Now, I can tell you from personal experience of trying to teach dentists this truth is that they do not understand that if a child does not develop right, then this upper jaw does not develop right. If they're a mouth breather, if they're tongue-tied, the tongue is not able to go into the roof of the mouth and cause the palate to be like a U shape. And if the tongue is not molding the area becomes like this and it becomes a V shape. Well, when you take where my palms are, those are where the teeth are, you can see that the teeth come in and this whole area is compressed. This upper jaw is too small. And when the upper jaw is too small, then this jaw has to go back in order for the back teeth to hit. Let's look at when things are correct. This is a correctly sized upper jaw. Just use your imagination. This is a comic type drawing, so it is cartoon type drawing, so it is not anatomically accurate, but it gives you an idea of what's going on in your joint. So this is a correctly sized maxilla. That's the upper jaw. It developed correctly, so the lower jaw fits nice and snug. They come together in a nice harmonious way, and when they come together in harmony, the disc stays on top of this condyle. This disc is kind of like a lifesaver sitting on top of a knob. Well, it only makes sense that if this joint is filled with fluid, and as this jaw drops down, it opens, the condyle is going to come down like so. And if it has this disc sitting on top of it, it's just going to rotate and going to translate just that much more comfortably. But if this upper jaw is too small, when the lower jaw closes, it is forced back. That allows the back teeth to come together. And when it is forced back, the condyle is squeezed, it is compressed, not enough room for the disc, so the disc slips off. Let me give you another example of a deficient maxilla. So here's a maxilla, these are the upper teeth. They've come in correctly. They go out towards the lip a little bit to fill in the lip, to give the lip some features. This is the way the lower teeth are supposed to hit. Well, if the front teeth in the maxilla is deficient and they're in like this because they didn't grow correctly, when the jaw comes down, if it doesn't pull back, then only the front teeth hit. And if you are a true deficient maxilla, more than likely your front teeth have wear facets on them. If you look in the mirror and close down, those wear facets usually line up perfectly. To me, as a practicing dentist, now retired, for me that is a sign of a deficient maxilla. Again, let me use my pointer. This is the maxilla. This is the mandible or the jaw. The jaw is only attached by the skin and the muscles and the tendons and the ligaments of the face. It is not connected to the skull. So these come apart very easy. When you person dies or you see cattle head out in the desert and they cattle bones, the jaw is not connected. Well, our jaw is not connected either. So it opens and closes. When it opens and closes, it hinges here on the condyles. And on the condyles, once again, I have to reiterate, you have a disc that's supposed to sit on top. If your disc is clicking, if your joint is clicking and making noise and you can't open very well, or your jaw deviates when you open, then that means that your disc is off of the condyle. So let's look at these black arrows here. This is the arc of closure, the way the jaw opens and the way the jaw closes. Now what we're going to do is we're going to make this upper jaw deficient. It's a little bit smaller. You can see that instead of the teeth coming out at this angle, the teeth are coming straight down. And if we keep that jaw-to-jaw relationship that exists here, only the front teeth are going to hit. Again, if you have anterior wear, this is probably what's happening. This is your jaw-to-jaw comfort position, so a lot of times you keep your lower jaw at this position. When the jaw-to-jaw relationship is right, the condyle and the disc relationship remains correct. But as you can see, there's no back teeth touching when you're hitting only on your front teeth. So in order for the back teeth to touch, look at this way the arc of closure is now. The arc goes like this and then it goes backwards. That backwards movement right here is what knocks the disc off of the condyle, and this is a compressed condyle due to a deficient maxilla. So how can you be helped? How can you get where that jaw comes forward, bringing the condyle forward and relieving all the pain from here? Sometimes, hopefully, relieving some of the clicking. That may not happen, but at least you're decompressing the joint. So how can you decompress the joint and keep it decompressed? You go to a neuromuscular dentist that really knows what he or she is doing. And they make you, they go through all these steps to find the proper relationship between the jaw, lower jaw, upper jaw, and the joint and the teeth. All have to be in harmony. And they make this appliance that overlays your lower teeth that mimics this bite over here. It's real simple in concept, very hard to do, and you've got to have a dentist that knows exactly what they're doing. But they are called neuromuscular orthotics, and they allow the jaw to go forward, which puts this joint in the right place. The orthotic has anatomy in it like teeth, so that when it closes, the upper teeth feel like they're hitting good normal teeth, and they feel like they're in this relationship instead of this relationship. Again, my name is Dr. Maxilla. I'm a retired dentist, 50 years of clinical dentistry, and I'm in my second career, and I want you to join me in my second career. And you can do that by going to Amazon. You can use this QR code to find my book on Amazon, The Life-Robbing Pain of TMJ, Why Me? And please follow me by going to the author and following the author, because this is just a simple pamphlet. It really gives you a really good idea of what's going on. It helps explain what I've been talking about, but there's not enough information. So I'm making a huge comprehensive book, and when it's available, I want you to be able to follow me. And the way I can get a hold of you is by going through the Amazon author page. I also, please follow me on YouTube, and there is my address. And I see that my overlay, my picture is over Dr. Maxilla, so, but you can figure that out. And also follow me on Podbean. Another Dr. Pam Mars Band and I have created a podcast all about TMJ, and we really, really want to help you understand your pain and understand what you can do about it. Thank you very much.